Okay, so hello dears. Welcome back to our pre-recorded lecture in our class in clinical parasitology. And for this video, this continuation, what we're going to discuss now are your hemoflagellates. Actually guys, naluyan ako sa filarial worms pa lang. So hindi ka pwede ako, but anyway, laban lang ta. Alright, so again, your hemoflagellates, you're done with this na in the lecture. So I'm sure, very confident na, I'll expect na yun, that this is a review na, this will be a piece of cake for you. So ano na lang, you already know these na. Alright, so your hemoflagellates. So this include, your hemoflagellates include your Trypanosomes and your Leishmania species. Alright, so they may infect your blood, your lymph nodes, muscles, and even your reticulo-endothelial system, RES, reticulo-endothelial system, or your RES. So what is included in your RES? Your spleen, your liver, mga ganun. Okay, so that's your RES. Okay, alright, next, for your hemoflagellates, we have 4 morphological stages, which is your first, your amastigotes, or also known as your Leishman-Donovan body or Leishmanial form. Next, you have your promastigote, also known as your leptomonal form. Next, you have epimastigote, also known as your critidial form. And lastly, you have Trypomastigote, also known as your Trypanosomal form. Okay, so ato ang mnemonic ana is of course your APET. Diba? Amastigote, promastigote, epimastigote, and trypomastigote. And yung other names, amastigote, also known as Leishmanial form. P for promastigote, also known as your leptomonal form. E for epimastigote, also known as your critidial form. And lastly, trypomastigote, nasa pangalan na, trypomastigote, also known as your trypanosomal form. Okay, alright. Now, these 4 morphological stages of your hemoflagellates, this is the order of your formation nila. So, amastigote una, promastigote, next your epimastigote, and lastly your trypomastigote. But not all, okay, not all of your hemoflagellates follow this, this pagkasunod-sunod, or this stages, this order of stages, okay? And not all also of your hemoflagellates have all of these stages, okay? Alright, not all of them, okay? Only some, I think Trypanosoma cruzi, exhibit all of these stages talaga. Alright, but the rest of your hemoflagellates, they all only have a combination, okay? A combination of these stages, but not all of them, alright? Okay, so if I'm not mistaken, yes, ganun. Alright, okay, so we'll now go through the first stage, which is your amastigote. So for the morphology, as you can see, it's round or oval. The nucleus is at the center, and you have a kinetoplast, which consists of a gut-like blepharoplast, this one, and also your parabasal body. It doesn't have yet any flagella. Okay, so as you can see, your kinetoplast is an umbrella term. Okay, for your parabasal body and your blepharoplast. So both of them are together. They are called as your kinetoplast. Okay, all right. And these features, no, these are just mga structural features that the parasite use, no, for its functioning. Okay, all right. So your blepharoplast and your parabasal body all together, they are termed as your kinetoplast. So that's for amastigote. Usually it's round. Okay, and it doesn't have yet any flagella. Okay, so for the next stage, we have your promastigote. As you can see, it now becomes long and slender. Okay, and your nucleus is at the near the center, located na, and your kinetoplast, as you can see, this one is at the anterior end. So meaning na siya sa center, na siya sa front. Okay, and there's already a single free flagellum extending from the anterior end. Okay, all right, ayan. Now for your epimastigote, the next one, it's more wide, it's wider and slender than your promastigote. The nucleus is much more at the posterior na, it is at the end, okay, from the center, okay. Tapos, the undulating membrane is already half the body length, okay. So, diba, it's much wider and your undulating membrane is nasa half, okay. And the flagella is at the anterior end pala, at the front, okay? And your kinetoplast, again, located anterior to the nucleus. So this is the posterior, munang likod, and the front, anterior. So your kinetoplast here nasa posterior, and the nucleus as at the front of your kinetoplast. So this is the kinetoplast. Okay, and mali, sorry. This is the nucleus pala, sorry naman. And this is your kinetoplast. Ang kinetoplast pala, ang nasa harap, or it's anterior, it's at the front of your nucleus. So this is your epimastigote. Okay? Alright. And next, of course, for trypomastigote, as you can see, it can be C, S, or U ang shape. The shape could be at similar to the letter C, S, or U. And it's often seen, the stage that's often seen in your blood films. Your nucleus now, as you can see, is in the anterior to the kinetoplast. The kinetoplast is much at the back now of your nucleus. So this is now your trypomastigote. So this is your kinetoplast, and this is the nucleus. So this is the posterior end pa rin, and this is the anterior end. So as you can see, this is the nucleus, and this is your kinetoplast. The kinetoplast is at the back, posterior na siya, of your nucleus. Okay? Alright. And then your undulating membrane is at the entire length of the body with your flagella. Okay. Alright. Extending from the anterior end pa rin. Okay. So as you can see, that's the different characteristic. Pero mas maganda talaga dito, dears. Okay. Alright. Ayan. So just take note of the different stages. Again, very important in your lecture na, and I'm sure that's already been discussed in the lecture. Okay. Now for general morphology and life cycle notes, the two most commonly seen stages in your peripheral blood or in your specimens are your amastigotes and trypomastigotes. Okay? Your amastigotes, are primarily found in your tissues and muscles, as well as mga macrophages and even in the CNS. Okay? And in macrophages, that is where they multiply. Okay. Your trypomastigotes, they reproduce and are also visible in your peripheral blood. For promastigote and epimastigotes, they're usually seen in the vector stages. Ang epimastigotes pala, sorry. But promastigotes, they can be seen only if the blood sample is collected immediately after transmission, which is, I think, rare to happen. You cannot really know that, this patient just had been bitten by the arthropod or whatever, or the vector. So, promastigotes usually rare lang siya makita din sa blood specimens. Okay? And for epimastigotes, as you can see, they are found primarily in the vector. As mentioned, the 4 stages, not all of your hemoflagellates have all of the stages. Okay? Alright. And not all of the stages can be found in your blood specimens also. Alright? Again, except for Trypanosoma cruzi, that exhibits most of the stages. Alright? The rest of your hemoflagellates, they experience a combination, or they have a combination of the morphologic stages. Example, amastigote and promastigote, amastigote, epimastigote, and trypomastigote, amastigote, promastigote, and trypomastigote. So combination lang siya. It's not like all of them talaga. Alright? Okay. Alright, so that's for the introduction of the stages and for hemoflagellates. Now we'll go now for the first, pictures pa pala. As you can see, those are the amastigotes. They are round shaped, no? Nucleus is prominent. Next, this is your promastigotes. One flagellum pala. Okay? And then you have epimastigote. As you can see, you can already see the undulating membrane starting to form. Again, the nucleus is near the posterior, and the kinetoplast is in front of the nucleus. Okay. And lastly, of course, trypomastigote. This is now the kinetoplast, diba? Very big. And then the nucleus is at the center. So posterior na. This time, the kinetoplast is at the back of the nucleus. Okay, the nucleus is quite, again, at the center or near the posterior. And this one is the flagellum, this one flagellum. And this is now your undulating membrane that extends the whole length of the body. Okay, alright, that's for the different stages. Okay, now we go on to Leishmania, the first species. For Leishmania species, they exist as amastigotes in humans and promastigote in the insect host. Okay. Depending on the species involved, it can result with cutaneous, diffuse cutaneous, mucocutaneous, and even visceral disease. Okay, so cutaneous means the skin lang, alright? Mucocutaneous, skin and the subcutaneous tissues or in the mucous membranes, and visceral includes everything, even the internal organs. Okay, alright. The vector is always sandfly or your phlebotomous species, or pwede ring Lutzomia species, no? Lutzomia, depending on the species of Leishmania. Lutzumia, or phlebotomus. Basta sandfly. Okay, this is your sandfly. The diagnostic stage are your amastigotes, but the infective stage is your promastigotes. Okay. The mode of transmission is insect vector, again through bites, or it can also be transmitted through blood transfusion, congenitally, contamination of bite wounds, and direct contact with contaminated specimens. Alright, but primarily it's through insect vector, the bite of your sandfly. The life cycle again, very simple. Promastigotes will be injected into the patient's body, and once inside the patient's body, the promastigotes are phagocytized or ingested by your macrophages, and within the macrophages, they now transform into amastigotes. And the amastigotes, they go out of your macrophages and invade other cells, and also is the stage that the sandfly will get from humans, and the cycle goes on. Amastigotes will then convert into promastigotes in the sandfly, and then the cycle will go on. Okay, alright. So here's your life cycle. As you can see, sandfly injects promastigotes. Your promastigotes are phagocytized or eaten by your macrophages. Your macrophages, the promastigotes inside your macrophages will convert into your amastigotes, and the amastigotes will multiply in the cells of various tissues and infect other cells. And your amastigotes will then go to your bloodstream, your blood vessels, and then once another sandfly takes a blood meal in the patient, it takes in the amastigotes, alright? And then once inside the sandfly's body, the amastigotes become promastigotes, okay? And the promastigotes will then divide and migrate to the proboscis, or to the parang needle, or the mouth of your the organ for biting, ayan, of your sandfly, proboscis. Okay, your mosquitoes and whatever, proboscis ang tawag dyan. Okay, alright, and then the cycle goes on. Alright, ayan. So that's for Leishmania. Now for Leishmania species, we then discuss them based on complexes. So meaning, Leishmania, when you say complex, there are still a lot of species, okay, within the complex. For example, for Leishmania brasiliensis complex, it contains a lot of species. Okay, so it's a group of parasites. So Leishmania brasiliensis, Leishmania panamensis, whatever. So dili na ko na siya i-specify, because again, that's in your lecture. Okay, i-specify na siya. Okay, alright. But Leishmania brasiliensis complex, by the name itself, complex. It's a group of parasites. Okay, name niya is Leishmania brasiliensis. Okay, so meaning it's mostly talking about the area, okay, or the countries which you can find this species. So Leishmania brasiliensis complex, the parasites under this complex, usually these are the parasites that are near to each other, or the countries that they affect, or the places that they affect are near with each other. Okay, muna siyang Leishmania brasiliensis complex. Okay. Alright. Now for Leishmania brasiliensis complex, your vector, Lutzumia or Psychodopicus sandflies. Your disease association is your mucocutaneous leishmaniasis, or which causes weeping lesions. Gabasa, your lesions have is wet. Okay? Ayan. Mucocutaneous, and death is usually attributed to secondary bacterial infection. Okay, so mucocutaneous weeping lesions, Leishmania brasiliensis. So here's an example of Espundia. You also have Chiclero ulcer, very disease association, and lastly of Pian-Boys. As you can see, the lesions or the ulcers are wet. It contains parang liquid. Okay, so mucocutaneous, it's not only superficial, it also involves the inner skin mga tissues. Okay, alright, that's mucocutaneous. Alright, that's for Leishmania brasiliensis complex. Next, we go na to Leishmania Mexicana. So, still the same with Leishmania brasiliensis. These are parasites under this group are found usually in the Mexican region, no? Dito sa mga Central America, ganun. So, Leishmania Mexicana complex, and then you have the different species under it. Example, Leishmania pifanoi, Leishmania amazonensis. So, mga Leishmanial species found within the Mexican region sa Central America, mga ganun. Okay? Alright, ayan. So, for Leishmania Mexicana, Lutzumia sandfly pa rin, it causes New World cutaneous leishmaniasis. So, sa skin lang, cutaneous leishmaniasis. Alright. And it causes usually pruritus, so itchy. It causes itchiness. Okay. Alright, so here's an example of a Chiclero ulcer caused by Leishmania Mexicana. So, as you can see, the terms there are, by the name itself, the disease pala, the terms are usually parang mga Mexican in origin, or Mexican sounding like, or mga parang South American sounding like, di ba? So Braziliensis, Mexicana, mga Chicleroser, mga Basor, mga Piat Boys, di ba? Parang Espundia. So it's like really sounding from the South American or Brazilian or Mexican ang sound sa mga names of diseases. Alright? So it points to the areas again as to which these Leishmania species can be found. Okay? Alright. Ayan. So this is for Leishmania Mexicana, New World cutaneous leishmaniasis. New World because diba, we consider the mga South American, mga New World na siya. Okay? That's why it's called New World cutaneous leishmaniasis. Okay? Because of the area, again, that they infect. Okay? The leishmanial species, the areas that the leishmanial species or this complex infect, which is the Mexican region, okay? Or the Central American region, ganun. Okay, that's Leishmania Mexicana. And the next is Leishmania tropica. For Leishmania tropica is also known as your old world cutaneous leishmaniasis because this is usually found in the Middle East, kana mga Iran, mga Iraq, ganun, di ba? Baghdad boils, Delhi boils, di ba? Aleppo, Jericho boils, so sa Syria, Dragdapitas, sa Middle East. So that's considered to be the old world, di ba? Sa Europe the pit, di ba? Asia the pit. Those are considered the old world. That's why it's known as old world cutaneous leishmaniasis. So this is the reservoir host, rock hyrax, as you can see, and also this is an example of Baghdad boils. As you can see, di ba, it's only superficial, cutaneous. Di siya parehas sa inyong Leishmania brasiliensis. It's not similar to your mucocutaneous, similar to the pictures, di ba, that there's really like a deeper wound, deeper ulcer that you can see that is not only superficial but really parang inner na, okay? It's mucocutaneous. There's a difference between mucocutaneous and cutaneous. For cutaneous, it's really superficial. But for mucocutaneous, it already involves parang mga inner layers of the skin. Okay, alright, ayan. So that's for the Leishmania species or Leishmania tropica complex. Okay, that's for cutaneous. And last species for Leishmania is of course the Leishmania donovani complex, which is considered to be the deadliest form. Then it causes the deadliest form of Leishmania, which is your visceral leishmaniasis. Okay, it causes what we call your Kala-Azar or Dum-Dum fever, or also known as your black fever. Ayan. Why? Because it causes blackening of the skin. Okay, alright, ayan. For diagnosis, gold standard is the demonstration of your Leishmania Donovan bodies or Leishman Donovan bodies or amastigotes within the macrophages. That's why the preferred specimen is your bone marrow. Okay, and we also have what we call your skin test, known as the Montenegro skin test. So we'll talk about skin test in the immunoassays part. But skin test is basically you inject a portion of your skin with antigens or a part of Leishmania donovani, and then you examine if there's a reaction in the skin. Okay, so here's an example of Montenegro skin test. Ayan. So this is called an induration. So naibutod na may tabo. Okay, alright, induration. And then we measure the diameter of this induration. And if the diameter is, example, greater than equal to 5 millimeters, then it means that you are positive. You have an infection with Leishmania or a past infection with Leishmania. Alright. And culture method, diba? Recall NNN and Schneider's medium. Schneider's na siya, sorry. Okay. And visceral leishmaniasis, again, very deadly. It can lead to death. Hepatosplenomegaly, and early stages may resemble malaria or typhoid fever. And again, that's why it's called black fever. It's because there is a characteristic darkening of the skin. So this is an example. Ayan. Darkening of the skin with mga sores. Alright, that's Kala-Azar or Dum-Dum fever or black fever. Ayan. Alright, before I forget, recall, what is that stain sa filarial worms na Liman could mention? The stain that is used to demonstrate the sheath, diba? Recall in our staining, what is that? It's your, what is the name, letter D? It's your Delafield's hematoxylin. Ayan. Basta if you want to stain the sheath, you use Delafield's hematoxylin. I hope press the buzzword. I hope na remember pa. Delafield's hematoxylin. Okay. For microfilarial sheath. Okay, ayan. Ako na di-push. Ako na di-insert yung ako na-mention sa filarial worms na video. Anyway, alright. That's for the Leishmania donovani. Again, usually causes the most deadly, the deadliest form of Leishmanial infection, your Kala-Azar or your Dum-Dum fever or your black fever. Why is it called black fever? Again, because there is a characteristic darkening of the skin. Okay. Alright, so that's for Leishmania donovani. Montenegro skin test, again, that's a skin test, positive if greater than equal to 5 millimeters ang diameter sa butod or sa induration sa skin. Okay, more of the skin tests in immunoassays. Okay, alright. Ayan, so here's an example of your mastigotes, di ba? Ayan. Leishmania donovani bodies or LD bodies. Diagnosis, gold standard talaga for diagnosis. Preferred specimen of choice is of course the bone marrow. Ayan. Alright. So this inner, again, are your mastigotes. Okay. Alright. Now we continue to your trypanosomes. Okay, so starting first with, of course, the Trypanosoma brucei complex. So it's still a complex, no? So gusto niyo mga complex. The Trypanosoma brucei complex. Why? Because it has two species which cause two different diseases pag yun. You have the Trypanosoma brucei gambiense, which causes your West African sleeping sickness, and your Trypanosoma brucei rhodesiense, which causes your East African sleeping sickness, which is more fatal compared to your gambiense. More rapid and fatal. Now, how do I remember rhodesiense? Maraming E, rhodesiense. So, siya ang East African sleeping sickness. Whereas ang gambiense, gamay lang E, ay gambiense. So, siya ang West African sleeping sickness. So, rhodesiense. So, maraming E. Okay? So, siya ang East African sleeping sickness. And brucei gambiense. Okay? Siya ang West African. Or you can also say gambiense. Ang letter M, di ba? Pag baliktarin mo siya, or if you reverse it, or if you make it upside down. You make it upside down, di ba? It's similar to a W. Ayan. So, West African. Dami ko na mnemonics na na-share ha. West African sleeping sickness. Okay. Alright, so that's Trypanosoma brucei complex. Okay. Now, it was first discovered to cause nagana in cattle. Okay, so na-discover siya to cause nagana, parang sleeping sickness pa rin in cattle sa mga baka. Okay, alright. Now, your vector is what we call your tsetse fly. Okay, so many times na, okay, even when I was still a student reviewing for boards, there have been debates or mga discussions on how to pronounce this. Okay, so I googled it, searched it in Merriam-Webster. So they pronounce it as tsetse fly. Tsetse. Okay, but some pronounce it as cheche. Okay, muna siya ngalan sa tita, no? Cheche. Parang mga chismoso na mga ngalan. Cheche, joke lang. Okay. Tsetse. Some pronounce it is even as tsetse. Yeah, but I pronounce it as tsetse. Tsetse fly. Okay, alright. So both the species can be transmitted by tsetse fly, but they differ in the species of the tsetse fly. So it's Glossina morsitans for gambiense and Glossina palpatis for rhodesiense. Okay, so how do I remember that? Wala na ko mnemonic for that. Basta I just know that it's tsetse fly. Okay, for both species, Glossina spp. Glossina morsitans, again, for your gambiense, and Glossina palpatis for rhodesiense. Okay, alright, that's the vector, the tsetse fly, this one, tsetse fly. Very common, again, in the African region, and that's why most of our mga trypanosomes, leishmania, and mga filarial worms are also found in Africa. Yeah, because again, it's very endemic. The place is endemic for the vectors, and likewise, eventually for the diseases. Okay. Alright. Ayan. So mode of transmission is the bite of the insect vector, other blood-sucking insects, needle prick, and even placental. But mainly, it's through the bite of your vector. The life cycle in the salivary glands of your tsetse fly, the trypomastigotes multiply, and they develop into epimastigotes pa rin, and then balik na po to trypomastigotes. Diba? So, trypomastigotes muna, and then they revert to epimastigotes, and then again go back to trypomastigotes, and this time they are now infective or metacyclic. Ayan. So that's why the infective stage is metacyclic trypomastigotes, and the diagnostic stage are your trypomastigotes. Okay. Characterized by an acute phase in which your peripheral blood and lymph nodes are invaded, followed by a chronic phase. So chronic phase na in which the CNS is invaded, which then leads to comatose. Okay? Meningoencephalitis and then comatose, which is now where we get the term sleeping sickness. Okay. That's why if you are to be asked what causes the African trypanosomiasis, it's Trypanosoma brucei. Okay? So African trypanosomiasis or your sleeping sickness is caused by Trypanosoma brucei complex. Okay? Alright. Ayan. Alright. Now we go now to your Trypomastic goats. As you can see, these are the Trypomastic goats of your T. brucei. And your Trypomastic goats of Trypanosoma brucei also, they divide in the peripheral blood. Okay? So the Trypomastic goats of your Trypanosoma brucei, they divide in the peripheral blood. In comparison to your T. cruzi, they do not divide in your peripheral blood, but they divide as amastigotes in your tissue. Ayan, amastigotes within the tissue. Okay. But for T. brucei, they divide as trypomastigotes in your blood or CSF. Okay. If you have Twitter, guys, you can follow him. Very good, as in amazing content, amazing tweets, ang dami. Mostly focusing on microbiology, bacte, and even para. Let's see, Sir Dr. Rich Davis. Yes, I follow him on Twitter then. So very informational, very insightful yung mga tweets. Okay, alright, ayan. So dividing Trypanosoma brucei. Again, T. brucei divides as trypomastigotes in your blood, whereas your Trypanosoma cruzi divides as amastigotes within the tissue. Okay, alright. So here's your life cycle. Again, tsetse fly, infective stage, injects the metacyclic trypomastigotes. The trypomastigotes again divide in your peripheral blood and they swim and then go to other areas. Diba? The trypomastigotes are again injected or ingested by your tsetse fly and another blood meal. The trypomastigotes will convert into your epimastigotes, and then the epimastigotes will convert back to your metacyclic trypomastigotes, now the infective stage, in the salivary glands of your tsetse fly, and then the cycle goes on. Alright? So as you can see, the Trypanosoma brucei does not have the amastigote or promastigote stages. Okay, so as I mentioned again, not all of your hemoflagellates have all of the stages. Okay, the appet. Okay, only some. Okay, alright. And that some, or that species that have almost all of your stages is your Trypanosoma cruzi. Alright. Now your Trypanosoma cruzi is the agent of your American trypanosomiasis, or also known as your Chagas disease. Okay, why is it called Chagas? Because it was first discovered or described by a young medical student in Brazil named Carlos Chagas. Ayan. So that's why it's known as Chagas disease or American trypanosomiasis. Okay. The vector this time is the triatoma bug, triatoma bug, also known as your kissing bug, reduviid bugs, assassin bugs, or cone-nose bugs. Ayan, kissing bugs or reduviid bugs. Diba? I mentioned this in our early activity, virtual microscope. Diba? Kissing bug, that's why it's called kissing bugs, because when it bites you, it feels like you are being kissed. Ayan. Or it feels like you are kissing. Yeah, it feels like you're being kissed by something. That's why it's called a kissing bug. Di ay to, gihalukan na ka. Well, gahalok ni mo, gaaluch mo, giyatagan na kang parasite. Okay, that's your triatoma species na mga bugs or your kissing bugs. Okay, the mode of transmission, very unique then and different from your other hemoflagellates, is contamination of the bite wound with the feces of your triatoma bug. During ingestion or during the feeding of the triatoma bug, diba? Pag bite niya nimo, during pag-feed niya, it defecates, di ba? Bastos. The triatoma bug, while it feeds on you, it defecates also on the surface of the skin. Now, because of the biting of the triatoma bug, it's itchy. So what happens is, of course, pag itch na to, or pag you feel itchiness, di ba? What you do is you scratch, di ba? So pag scratch mo sa area, you also include the feces, which contains the trypomastigotes, into the bite wound. And that is now where the trypomastigotes enter your body. It's through the contamination of the bite wound with the feces from the reduviid bug. Okay, that's the main mode of transmission. Other modes of transmission, blood transfusion also, sexual intercourse, transplacental transmission, and entry through the mucous membranes if the bite of the bug is near the mucous membrane, like the eyes or near the mouth. Okay, alright. But most of the time, it's contamination of the bite wound. So example, again, gipaa ka, the reduviid bug bites you on the skin. So while biting you or while feeding on you, it defecates or malibang siya. Okay? And its feces contains now the trypomastigotes. Okay? So after biting, diba? So it's itchy. So what you do is you itch, diba? So what happens? The feces of the Triatoma bug or the kissing bug, which is also on the surface, diba, will now be transferred, okay, or will now infect the bite wound, okay? And this is where, this is now the portal of entry, or this is where the Trichomatic Goats enter your body and cause infection. Ayun. So that's the mode of transmission for T. cruzi, but very different from the rest of the Hemoflagellates. Okay, alright, ayan. Life cycle, metacyclic Trichomatic Goats invade the macrophages, becomes amastigotes, and then they will now become, from amastigotes, they then convert back to your Trichomastigotes. Okay, infective stage, metacyclic Trichomastigotes, diagnostic stage, Trichomastigotes, and even amastigotes. Ayan, alright. Lab DX, demonstration of the Trichomastigotes in your blood-stained films, either C or U shaped, usually C or U shaped. Okay, and we also perform what we call xenodiagnosis. The test animal that we use are the vectors, reduviid bugs. And then what we do is we examine the feces for your Trichomatic Goats. So how does xenodiagnosis work? Xenodiagnosis work, example, you employ a patient positive with Trichomatic Goats, or you employ a patient suspected of having American trypanosomiasis. Then what you do is you let the reduviid bug feed on the patient. And then you examine now the reduviid bug, okay? So you let the reduviid bug defecate or malibang siya, and then you examine now the feces for Trichomastigotes. And once the Trichomastigotes are found or present in the stool of your reduviid bug in the xenodiagnosis, then that confirms that the patient is having trypanosomiasis, American trypanosomiasis infection, okay? That's xenodiagnosis. You use your animals, okay? You use animals to test if the patient is having this infection, ganun, xenodiagnosis. Alright. So we examine the feces of the bugs. Alright, that's for T. cruzi. Okay, alright. Now for T. cruzi, this is your triatoma or kissing bug that's really big. Cone nose, kaya muna siya cone, ngayong appearance. And assassin, it looks like an assassin. Di ba? Muna siya mamatay. Mamamatay tao, yes, assassin, because of its appearance. Okay, triatoma or your kissing bug. And this is the characteristic appearance of your T. cruzi Trichomastigote, diba? It looks like a C or U na shape, usually ang kanyang appearance. Alright, so this is again your life cycle. Triatomine bug takes a blood meal, okay, enter bite wound or mucosal membranes as mentioned, and then the Trichomastigotes will now invade your cells, diba? And they transform there as amastigotes. And then amastigotes, once they rupture or go out, they then become again Trichomastigotes. Okay, the Trichomastigotes can infect other cells and then also become amastigotes ulit, and then Trichomastigotes ganun. Or the other Trichomastigotes will then be ingested by another triatoma bug in a blood meal, and the Trichomastigotes will convert into epimastigotes in the vector in the triatoma bug, and then after epimastigotes will divide into different epimastigotes and then convert na po back to your Trichomastigotes in the salivary glands na po of your triatoma bug ready to infect a new host, and the cycle goes on. Ganun. Okay. Alright, that's for T. cruzi na life cycle. And lastly, okay, is the comparison, again based by Dr. Rich Davis, between the Trypanosoma brucei and the Trypanosoma cruzi na Trichomastigote. So we look at the kinetoplast. As you can see, small kinetoplast and Trypanosoma brucei, but for Trypanosoma cruzi, it's a big, large kinetoplast. Again, divide as amastigotes in tissue on Trypanosoma cruzi, but for Trypanosoma brucei, they divide as Trichomastigotes in your peripheral blood. Okay, and lastly, Trichomastigotes are much larger than your RBCs, whereas for your Trypanosoma cruzi, they are smaller than your RBCs, or smaller than your T. brucei. Alright, and it's usually at the size of an RBC. Same with the size of an RBC, okay? And look at this parang eye nila. This is again your kinetoplast, okay? And it's larger in Trypanosoma cruzi, whereas for Trypanosoma brucei, it's much smaller. Okay, alright, ayan. And again, by size, mas dako ang T. brucei and ang T. cruzi ang smaller. Okay, alright. Now for the next video, ayan. Naluyan ang chuko. But anyway, laban lang. Anything for you all. Charot. Anyway, alright, for the next video, we'll now go to the last group of your blood parasites, and these are your sporozoans. So, direta medyo mas intense siguro ang discussion, mas daghang chika, especially now that we're focusing on malaria. We'll now be focusing on malaria. Alright? Alright. So, I'll see you on the next video. Okay.